Hello, my name is Dr. Brian Raid, and I am a naturopathic doctor. And this is a video about why some people react to certain forms of herbs and not to others when they're dealing with small intestine bacterial overgrowth or other digestive issues like large intestine bacterial overgrowth or small intestine fungal overgrowth or intestinal methanogen overgrowth or whatever kind of overgrowth from kind of here to the bottom end might be happening. So there's different properties that different herbal extract forms might have that certain other extracted forms of those herbs might not have. So for example, if we take something like an essential oils have a lot of volatile components to them. And those volatile components, they can be very effective at breaking down phase 1 biofilms. Maybe phase 2 biofilms a little bit, but if you're working with something like an essential oil and it seems to be causing a flare-up, it might be because it's really, really strong. Essential oils are very strong antimicrobial agents, so it might be that it's just killing things too quickly, it's causing a bit of a die-off reaction or a Herxheimer reaction. Or it's also possible that it might be working to address biofilms and it's actually helping to break those down a little bit, and that could be inducing a flare. And kind of figuring out what the kind of differentiating between the two of those, we really don't know, because of course there's no studies looking at this. There's really no test that I could even think of somebody running to really figure that out for sure. But what seems to play out clinically is that if a person's taking something like an essential oil, or it could be a tincture as well, something that has a lot of aromatic compounds to it, like say cloves, for example, whether it's clove essential oil or even clove tincture, it's very aromatic and pungent. I think it smells quite nice. Doesn't taste fantastic in a tincture, but what does really? So if there's something that has a more aromatic component or these volatile components to them, then if a person said, I'm taking this and I'm just ramping up the dose, or I start with a full dose or whatever it happens to be, and they feel worse right out of the gate, then that would suggest to me, well, maybe this is just too strong. Whereas if a patient says, I've been taking this for a while, I was on it for a couple of weeks or maybe the better part of a month, and I seem to be doing well with it, and now it seems to be aggravating me. It seems to be, my symptoms seem to be getting worse. My gas and bloating was getting better. My other digestive parameters were getting better, not as much abdominal pain, and now that's starting to creep back and nothing else has changed. It is possible in that instance that maybe the herbs have just lost their efficacy. Maybe the microbes have built up a tolerance. I don't really see that happening in practice, with rare exception, but it is possible. It's also possible that the herbs have been working very well to kill off everything out in the open, and now those biofilms are starting to get whittled away at, and now there's microbes that are coming out of hiding and ultimately creating some symptoms again. So that's kind of the way that I try to clinically differentiate what might be going on with the patient. The other factor to consider when it comes to different forms of herbs, like the way that they're administered, is that some folks are really, really sensitive to alcohol. So sometimes when we're using tinctures to go after again, yeast or SIBO or whatever it happens to be, some folks find that they flare up really, really easily. And I've had patients who, they're getting down to just, a few drops a day of tincture, and more than that seems to flare them up. And I find that when I switch them over, say, to an encapsulated form of an herb, then they might tolerate it just fine at full therapeutic dosages. Those would be patients who would have more of a predisposition to histamine intolerance, or maybe a sulfur sensitivity, which is more accurately referred to as a sulfite sensitivity, but tomato to some extent. And so there's kind of usually be some clues or writing on the wall there, but sometimes it's not always that obvious. So what I would say to clinicians out there that might be listening is, if your patients are dealing, or if you're having a hard time kind of getting them on a protocol, you're like, oh man, you're really sensitive to this, well, maybe try a different herbal extract type, whether it's trying a dried herb instead of a tincture, or using a tincture instead of an essential oil, or maybe switching up the herbs that are in there that don't have as many volatile organic or volatile compounds to them, like essential oils, or other aromatic compounds that might be disrupting biofilms. Or if you're a patient listening, then if you're having trouble with your protocol, maybe ask your clinician about whether that's something that might be going on, because trying to figure out the right dosage, like the first step is finding what's the right diagnosis. Like, oh my gosh, I have SIBO, I've got LIBO, I've got a yeast overgrowth, whatever it happens to be. That's great. That's exciting to find out what's going on, but then of course successfully treating that is the next step. So knowing about some of those individual characteristics of certain herbal formulas can be very useful.